From my dealings with veterans, the status of a Royal Commission was something that was really important to them. But given that status, they also want answers and agree with this ongoing commission of inquiry. In your view of things, what needs to change and what can be done more immediately?
Well, the first thing I need to do, Laura, as the Minister, is to make sure the good work we're doing now continues. So the work that the RSL, Soldier On, Mates for Mates, Legacy, all that good work that's occurring now in partnership with the Department of Veterans Affairs, that good work is actually saving lives today. So I need to make sure that work continues and we don't take our foot off the pedal in terms of accelerating those programs that are working and exploring new ideas like psychiatric assistance dogs we introduced about 12 months ago. Those types of new ideas are working, and so we need to keep doing those. But at the same time, I think we need to keep listening to our younger veterans in particular, because they've had a more recent experience of a 20-year conflict in Afghanistan and Iraq and more recent peacekeeping missions, to make sure that the services are relevant to them today. And that's a challenge for us, making sure those contemporary veterans are accessing services as well. You know, some of them have been reluctant to join the ex-service organisations, so we need to find out why there's that reluctance and how we can get services to them that will make a difference. And we never want to underestimate the value of community partnerships on these issues, that families, communities, sporting groups, they all play a part in this as well, because they're the groups, they're the individuals that see the first signs and can say, mate, you need a bit of help here, or this is where you should go, open arms is available, let's get you some support, because there's no shame in that. And we've got to get rid of this stigma around mental health, Laura. It's our biggest challenge in terms of this particular issue, is letting younger blokes in particular, but young women as well, let them know that it's okay to seek help if you've got a bit of a problem, and you can recover if you get the right help.
Just one final question on Anzac Day. We were celebrating last week when the number of places for Anzac Day marches right around the country was increased, but we're getting anecdotal feedback that it's just still too prohibitive for some of our veterans to be taking place in that, and many of these spots haven't been filled. Have you been able to sort that out?
Well, I don't want to be seen to be passing the buck, but the Anzac Day services are a strongly kept priority, I guess, of the RSL groups around the country and the state governments themselves. So the federal government doesn't tell the state and the RSL what to do in that regard. But what I would like to see is as many people as possible, obviously, participating in dawn services and marches, paying their respects in an appropriately dignified and solemn way, and making sure we recognise the sacrifice of previous generations, but also the men and women who continue to serve today. So that's our challenge, to make sure that we do it in a dignified way. Now, whether it's at the front of your own driveway, a silent vigil, or at a dawn service in your local town, or a major city march, we just encourage people to pay their respects, say thank you for your service, and respect those who've given so much to our country. Now, I would like to see as many people as possible do that and pay their respects on the day.